Welcome to another episode of the Your Longevity Blueprint podcast. Today I have two guests, Dr. Hannah Anderson and Dr. Calla Jayne Kleene, who are chiropractors at Back in Line Family Chiropractic in Hiawatha, Iowa. Dr. Anderson specializes in pediatric and maternal health with trainings including a CACCP from the International Chiropractic Pediatric Association, Neuroemotional Technique, and Mercier Therapy. In addition to Dr. Kleene's many chiropractic and myofascial trainings, she has a diplomat from the American Academy of Anti-Aging Medicine. Both doctors passionately guide patients from a holistic perspective, whether it's through pain or wellness planning. Welcome to the show, Dr. Anderson and Dr. Kleene.
Thanks so much for having us, Steph.
Hi, Steph. Thanks for having us.
For those subscribers, you may recognize Dr. Kleene's name. She actually wrote the foreword on my book, Your Longevity Blueprint, and was one of my very first guests over 100, probably over like 120, 30 shows ago. I think it was episode number 2.
Yeah.
So I highly encourage you go back and listen to that episode if you have not yet. But on to today. First, I would like to hear from both of you kind of the story behind the creation of your Girl Talk events and how you became so passionate about advocating for such discussion. So through this conversation, I'll just let you guys take it away, each answer. We'll see how this goes.
Yeah, Hannah, do you want to tee it up for us?
Sure, I can. Yes. So like she said, I specialize in pediatrics and women's health, which leads me to see a lot of women in practice whose lifelong health has been dominated by this idea really that their body is inherently faulty or trying to trick them. And so they're often, come in with these ideas that I feel like start a lot during puberty, where like acne and painful periods get blamed on fluctuating hormones because they don't necessarily have the resources to get to the root cause of those issues. And like any parent, myself included, parents don't want to watch their children struggle, and the parents then find a doctor who thinks giving hormonal birth control will fix it, or just do something because if it's the only thing they know how to do. And unbeknownst to them, the doctor prescribing that birth control often might not know how to get them off of it later. Like there's no exit plan. They never initially told them like the pros, cons, and side effects of it. And they didn't offer any support while they were on it, which would all be great things to have a plan for. So then they wind up in our office either months or years later because they don't like where things are at. And they're like, at this point, I'll try anything, even that weird chiropractor my friends go to. So then they end up with us because they feel like they've kind of hit the end of the line somewhere else. And I kind of feel like it's that story repeated a bunch, plus the fact that I have 2 daughters and I genuinely don't want that to be the only option for them when things get frustrating with their bodies around that time. And I want them and all their friends to know that they were perfectly designed and are not faulty in the least, and that there's a different way to care for women's bodies. And they might not listen to me, but I'm not going to say nothing. It's going to be there so that maybe they can go back to it when they are ready to hear it. But yeah, that's it. Like the short and sweet of it is we've just seen a pattern over and over, stemming from a similar issue. And I'm sure CJ has her own walk, but that's kind of, I think, at the root of mine.
Very well said. Yeah. CJ, what do you think?
Yeah. So it was a couple years ago when I came to Hannah and I said, and it was probably when I'm like, hey, I need you to adjust me. My adrenals are hijacked, and we're talking, and I'm like, hey, if I see another 12-year-old girl that comes in as a patient that had 1 or 2 really bad periods, and the next solution was to go right on birth control, I feel like I'm repeating the same conversation over and over again. I'm like, I think we need to talk about this like on stage and invite mothers, daughters, aunts, like really just have this really incredible conversation about how cool our body is and our physiology is. And I think even the whole journey, like once I became pregnant and becoming a mother, that was really transformational. But even after chiropractic school and all the schooling I had heard, I still didn't really understand the cycles. And so Hannah and I just started having more and more conversations, and then we wanted to get nerdy with it, but we wanted to, empower our daughters to have autonomy of their body, but to have autonomy, you have to understand it. And there's so much societal of, worry that we're going to hypersexualize our kids if we talk too much about it or introduce it at inappropriate times. But then there's also like the swing of, but where are they going to find out about it if it's, the internet or some just misinformation. And so it's really just a really fun event that women come to. It's invigorating dialogue. And, I had, from the first girl talk that we had, I had girlfriends that approached me after, and they're like, I'm 45 years old and have, 4 kids, and I learned more about my vagina than I've ever been taught my whole life. And so I think that makes it, so fun. But again, it's just this dialogue about the uniqueness of your hormone and your body's journey compared to mine, compared to our daughters, and so on. But just having great conversation together makes it really fun for me.
Agreed. I remember I think it was the first event you guys had. I remember, Hannah, specifically you talking about just like the shame almost with, women talking about their female parts and anatomy and how we shouldn't have that shame. And I think maybe even you had everyone say vagina and say some of these things, and like people were laughing, but that's really important. And so let's kind of maybe go to that for a second. Like, let's talk about the importance of learning female anatomy, how important that is for women's health. Who wants to take
I
note?
mean, it is wild because even so, part of my background is that I taught college anatomy and physiology. Like I grew up as soon as I was in a cadaver lab in undergrad, I was like, this is my space, which like 0.001% of people I think on the planet would say that. But I was like, this is my home. This is my language. I get it. And so I TA'd the whole time I was in grad school, and then I taught college anatomy and physiology. And so when we do the event, the first half of the event is I walk everyone through like, here's what the true names of all of the female anatomy parts are. And even some of them, like there are like the Latin word pudendum is what we would now call the vulva, but like pudendum in Latin means shameful. So like at some point, right? I'm guessing it was like a big group of men were like sitting around a table and trying to decide what to name female anatomy. And they were just like, that's all shameful, so that's kind of a wild one to start with, but there's so many important reasons, but a big one for me is just it provides respect for what you're talking about. So, if you give it a jokey name, then it becomes a joke. And it's also a safety thing. Like if your kids don't know what their body parts are called, if something, God forbid, would happen to them, they can't give you an accurate description, of what's going on if they don't think it's okay to tell you about it. But yeah, also just that idea of like, I mean, like I said, I have two girls. They are currently 5 and 2. And if we tell them something and we laugh about it, like then they think it's funny, that's like why jokes catch on with kids, is if they get one laugh out of it, then they will do it over and over again. So you do have to play that straight face, even if you're uncomfortable. And we talk about that at the event too, is just if you're uncomfortable saying some of these things out loud, you need to figure out why you are uncomfortable as the parent or as the adult or as the teacher. Is there something in your background or how you were raised? And people will get embarrassed and they will struggle with this part. And sometimes they think it's because they're being a bad parent or something like that. And I truly think everyone is doing the best they can with the tools that they have right now, right? So like my parents did the best they could with what they learned and how they were raised, and I'm just doing the best with what I know and how I was raised. And so it's not that everybody isn't doing their best, it's just we're trying to kind of improve every time, and it just wasn't always out in the open. So yeah. Also sometimes I go through the anatomy and people are like, oh, I didn't know that was the right word for that. So even as adult females, it's not like they've gone through and double checked it all and all that stuff. So
CJ, what do you think? You want to add anything to that? How important knowing our female anatomy is?
Yeah, I think, knowing it, but even like connecting to it. And we'll get into this as we talk more about birth control, but just really connecting with every part of our body, from breath work, so important, to diet and nutrition. But really, if we understand that our harmony throughout our cycle, women have a 28-day-ish cycle where men have a 24-hour-ish cycle. And so I was always raised, and again, to reiterate what Hannah was saying, I was raised with my parents doing the best that they knew with what they had. And a lot of times I was taught, I had 2 brothers, and I've learned a lot from being a sister with an older brother and a younger brother. But I was always taught, and I'm grateful for this as well, but I was taught anything a boy can do, you can do too. And I think that's been helpful for a lot of parts of my life of just being able to be resilient and strong through it. However, kind of where I'm at now in life is just because I can do everything a man can do doesn't mean I should. If we understand the physiology and the harmony of our cycles, and that, when I look back into high school and even some maybe knee injuries and stuff like that, I can't help but wonder, did that happen maybe when I was on the pill, or did it happen during various stages through my body? Like maybe I was having my period and I pushed it too hard at cross country,
Sure.
wasn't getting enough risk, and that put me at vulnerability. So knowing the anatomy, but also taking it even nerdier, just the physiology that, the first half of our cycle compared to the second half of our cycle are different. And if we can teach each other and our daughters, they might be able to do better and listen to the intuition of their body and where they're at.
Awesome. Yeah, let's go to birth control. So that's I think maybe the blunt of this conversation, where that's going to go. So I want to know kind of what you both see as pros and cons of birth control. And we can get into informed consent maybe after this, or the lack of informed consent, I should say. But let's first talk about what pros and cons you see of birth control are.
I think the major pro, coming from a super type A person, probably to Steph as another super type A person, right, is just that idea of like knowing exactly which day things are going to happen. And I do genuinely think that's why a lot of people rely on it, is because it's then a part of their brain they think that they get to shut off, is they're like, oh, that is handled by me doing,
Sure.
simply taking a pill every day. And as long as I can remember that, I don't have to think about any of that. And you can kind of like wall that off, which isn't really how it works. But in theory, I can see how that is really appealing. And if you don't know the side effects, that sounds great. For me personally, like I genuinely didn't want to have a child while I was in grad school. So I went to my day of graduation and counted back 9 months and went off birth control like that day, just because I wanted to make it through all the way.
Sure.
So obviously that part. And then I don't necessarily know if it's helpful, but I do think it is desired as a pro for it to like be an answer to these hormonal questions. I just don't necessarily think it's like the true answer. CJ, am I missing anything as far as pros?
Oh, I think it's just that freedom of control is so much of it. But I think now with birth control, from if I have a son and a daughter, and my daughter has acne and I take her to the doctor, right out the bat, they're going to say, oh, well, let's put you on birth control. But if I take my son with acne, they're going to give him an acne medication, or if my daughter has headaches, they're going to give her birth control, but my son is going to maybe get something else. And so birth control, we often forget, it's to control pregnancy, which is usually the idea, and that was the intention behind it. But now what we're seeing is that birth control is given for so many different things, from PMS to PMDD to polycystic ovarian to all these other different things. And so so much of the control, I understand that. I have a bigger concern too with birth control. It's being prescribed for things other than preventing pregnancy, and it's only in the female population.
I would agree. You guys answered that well, you ladies, I should say. I do think for some women, even myself, I had very heavy cycles, didn't know I had endometriosis at a young age. I didn't take birth control, but it was certainly recommended. And for some people, it does alleviate pain. It does limit heavy bleeding, right? It's a short-term Band-Aid solution. It's not something, it's not getting to the root cause of the problem, but for some women, for a short period of time, it alleviates some of their symptoms. So I guess I could see how that's somewhat of a pro there. But let's get into more cons. And I think though that can kind of overlap into the next part of the question, which is kind of how thorough you think the average birth control prescriber is with informed consent. I can tell you, when I was young and was recommended birth control, they didn't tell me anything, any side effects, any nutrient depletions that could occur as a result of that. It was just offered to me. And my mother was absolutely furious when I told her that. And thankfully I had a mother who was advocating for me back then and took me to a chiropractor who recommended herbs for my periods. And, I was very blessed to be in the situation I was in. I think I was definitely in the minority, especially back then. But let's talk about informed consent, and then also kind of some of the cons of birth control long-term use.
Yeah, and I guess if you don't mind, before we talk about that, I think it's
Yeah,
important to explain maybe how birth control works,
go for it.
right?
Yeah.
So there's several different types of birth control, from the IUDs to the NuvaRing to the implant devices. I think it's called Implanon, and then there's the oral birth control. And so there's various degrees of it, but essentially the mechanism of interaction and how it works in our body is that um, it's extremely high doses of synthetic hormones. So now you can have estrogen only birth controls, or you can have combo pills that have progesterone and estrogen. And then you can have like the mini pill, which is just progesterone only. And they all have various degrees of differences.
And I have to correct you because I have to say it's progestin only.
Thank
It's
you.
not natural progesterone.
Yeah.
Just for the listeners, and we can differentiate that in a bit. But yes, but you're correct with those three, the last being a progestin, synthetic, yeah, only.
Synthetics, yeah. So synthetics think that they're bad. They're not the exact same molecular structure that our body manufactures, but it's enough of a hijacking that it tells our brain to stop communicating with our breast tissue, our uterus, and our ovaries. And it says, just shut that down. And so it's this chemical alteration to our body and to our brain, which then kind of cascades some other issues down the line with all hormones. But when we have that high dose of synthetic, that also tells our breast tissue and uterine lining and ovaries to stop making your own natural hormones. So for some people, we're really suppressing hormones overall, but then really toxing the liver with high doses. And then two, Stephanie, I don't know if you have any good infographics that maybe you can include, but just what the cycle looks like of estrogen and progesterone throughout the 28 days that we can include, because you'll be able to see that days 1 through 5, most of our hormones are very suppressed while we're bleeding. And then there's the slow progression of the estrogen to rise. And then that big high spike tells the brain to release luteinizing hormone and follicle stimulating hormone. Then that estrogen goes down, and then the progesterone really dominates the second half of the cycle. And so when that's just a different single hormone cycle every single day, or picture of what our hormones look like, when we're on that synthetic, it is just high doses the entire time. So we look very chemically different when we're put on birth controls.
Yeah, absolutely. And I don't like that either. I think we were created to have these natural rhythms, right? And so then we just slam women full of this dose. Many times for the oral pills, right? It's 3 weeks out of the month, and then they take nothing, the sugar pills week 1, and then back to just kind of, you're slammed on those higher synthetic doses, which prevent ovulation, which can, and can prevent implantation and whatnot. So they prevent the pregnancy from happening. But some other bad things can happen in the meantime.
Well, and you said that too. I don't mean to interrupt you, but just to even highlight, the suppresses ovulation. So if we think about it, what happens when women are on birth control for 14, 15 years and they have been suppressing ovulation? And the traditional standard is what, the primary care, the prescribing physicians, for this, they're saying, oh, it takes 3 months for your body to rebalance. And it's like, how is that possible that for 15 years of hormone suppression, that we've been shutting our brain down to our ovaries, that all of a sudden we think we're going to start ovulating 3 months after going off birth control? And then, there's the argument, I have several friends and family members that have been conceived while on birth control. And so then I think people think like, oh, but it's not a problem. People get, pregnant on birth control all the time.
It's not all the time. It's exactly. Yeah. But no, I get that.
So to talk about the informed consent part, I think just to like outline what that's supposed to be is, so in any healthcare profession, right, whether it's us adjusting someone as a chiropractor or you practicing how you do, we're supposed to go through, to the best of our knowledge, the pros and cons of a certain treatment, then leave that open to our patient to say, yes, I'd like to do that. No, I do not want to do that. And that should happen, whether it's us giving a supplement or, a treatment, and that discussion should always be on the table. And if the patient wants to walk away at that point, that's totally fine. That's in there. They're informed and they can consent or not consent. And so what we struggle with, oftentimes, I mean, like you said, how you got offered a birth control prescription is very similar to how I did, where there was no or
Mhm.
con. Like I was given no cons at all.
Just basically
Um,
told to take it. Exactly.
yeah, exactly. Yeah. And it was like, here it is. And
Mhm.
there was no like, even you might feel tired. You might, this might happen. So, when no cons are given, then that's not true informed consent. And I don't think it's a super ethical way to practice, my personal opinion.
Mhm.
So, that is a huge issue for me, especially now to the point where I think there are, teenagers that will go to appointments by themselves. And I think a lot
Mhm.
that probably upped a lot during like COVID stuff, right? Where it was like, well, you can go in by yourself because we only allow one patient at a time or whatever. I'm sure
Mhm.
that got increased a ton. And while sometimes that is easier for parents, like they're like, oh, they can finally drive themselves to doctor's appointments and that sort of thing. It's like, yeah, but they're also their teenage brain doesn't know to ask, like, could you please give me the pros and cons? And also, I'm going to fully digest them in the 5 minutes that I'm sitting here, make an
Mhm.
informed choice, and commit to something that's not likely in my head. So yeah, I do see that as an issue. They aren't being told, there's a stroke risk, or like
Mhm.
me personally, like I do have a history of females having strokes on my maternal lineage. That was a huge red flag for me. I didn't know about it until I was already on it. And that was part of the reason I was like, well, I got to get off as soon as I humanly can, because, that's a big deal to me.
Mhm.
So yeah, and I mean, that's part of why it's such a big issue for us, is we think it is often given without true informed consent happening.
Yeah, kind of scary. I think I want to go back to what you were saying, CJ, on there's just so many comments I want to like make sure on what you were saying the return to fertility is, which isn't important, for a 19-year-old, but some women who maybe do take birth control for 10 years and then they find their significant other, get married, want to have a child, right? They probably aren't educated on that return to fertility could take a year or 2 years, right? They just kind of assume, like you're saying, they stop the pill and they can get pregnant when they want. And it's just not that easy. And I would also maybe even argue that it may be more difficult for that individual to get pregnant anyways. Back to the root cause as far as why they were put on the birth control in the first place, they probably had some underlying hormone, right, issues
Right.
for which they were
Right.
now masking the issue with the birth control. So then long term, their ability to get pregnant may actually be more challenging, unfortunately.
Well, and two, sorry to interrupt, but back to, the informed consent. So when we look at literature for what the pharmaceutical companies are giving providers for patient education, and there's some patient education material that says that birth control tricks your body into thinking it's pregnant, and really kind of dumbs it down. And I really liked how Dr. Jolene Brighton said the body isn't that stupid.
Right. Yeah.
And it's this oversimplification of what it's doing, to us. But really, like that informed consent should be like a page long that says it's a known grade 1 carcinogen. On average, 1 to 2,000 girls die each year on birth control. So that's just death, which sounds awful.
Mhm.
But people think, oh, that sounds like that could be rare though. But that's not the statistic of, well, then how many girls are injured because they had a stroke and have to relearn how to
Mhm.
walk. And I don't mean to then over dramatize what could
Right.
happen. But then two, one of the biggest things that I don't think is talked enough about is the mental health, aspect of it. One of the
Mhm.
studies that we came across was a Danish study that said girls put on birth control. And there's a lot of talk about before the brain is fully developed, because this is the high growth rate of brain and brain development. And so when
Yeah.
we're
Yeah.
chemically altering with some of these hormone receptors, so many, like our heart has estrogen receptors, which makes the estrogen and the progestin so potentially traumatic to the heart, because it could be pro-inflammatory. But we have all these hormone receptors throughout our entire body. And if we're suppressing that natural production, but then hijacking it with high doses of the synthetic, we are going to alter our brain chemistry. But this Danish study said that girls, if they were put on birth control around 15 to 19 years old, there was a 70% chance higher rate of depression. So then it's kind of in that cascading drug that,
Yeah.
okay, you went on the birth control and then 6 months later we have the depression. So now here's the antidepressant or here's the anti-anxiety. And then there was another study that said that patch and the vaginal rings tripled the rate of depression. And then since 1975, there's been a 400% increase breast cancer rates in women, which I don't think is just the birth control. I think that's a lot of things, Steph. You've done so much in your podcast. Yeah.
Well, and I would say I see that clinically support the first statistic of birth control than antidepressants or anti-anxieties. I see that clinically supported like almost to a T. If I have someone, especially someone in their 20s that has been on birth control since they were a young teenager, they're almost always on 2 medications, and it's rarely just a birth control. That is slim pickings to come through the door. So it's just, I mean, it is wild to see it, read it, and then watch it play out in real life.
Oh, go ahead, Steph.
No, you go ahead.
Well, so many patients, girls and women, they don't even correlate that their birth control is a medication. Like in our intake forms, and people will come in for infertility or hormone issues, and they don't even mark down that they're on birth control. And so sometimes I'll be like, oh, wait, so you're on birth control? And they're like, oh, yeah. And it wasn't even at the forefront of their mind that like, that is a medication.
I see that a lot for IUDs too. Patients don't write them down. I'm like, no, that it is definitely releasing a synthetic medication in your body. Gosh, I want to comment on so much of this. I think it would be super interesting to actually for a listening graduate student to do some sort of, study on statistics for informed consent for birth control, because I literally, I bet it's like less than 1% is actually
agreed
thoroughly, provided this informed consent. And I actually think that's probably true for a lot of medications. I think that we here at our clinic, at least, we spend quite a bit of time going over pros and cons of the hormones we're prescribing. But I would say, I think for statin medications, for blood pressure medications, and for reflux medications, I don't think, proper informed consent is probably happening. But obviously, today's discussion more pertains to birth control. I want to go back to the clotting that you said, Hannah, because I literally just before we started recording, I grabbed this book off my shelf, which CJ, you just mentioned, Beyond the Pill by Dr. Jillian Brighton, who I'd love to have on the podcast here. And I literally just opened this up, and the page that I had bookmarked was around just genetic risk factors for things like strokes. So I actually have this underlined here in reference to patients who are on oral birth control and also have the MTHFR genetic variant. They have huge increase. So this is saying, again, I literally just opened this. Let me read this real quick. So another study placed the threat of stroke in women. Okay, this is with factor 5, taking oral contraceptives as high as 35% fold increase. Women with MTHFR 677TT using oral contraceptives had a 5.4 fold increased risk of stroke. So whether you have like factor 5 clotting issues or MTHFR clotting issues, I guarantee your provider who's prescribing you birth control isn't asking about that or is not aware.
Isn't checking. And like, what a world if that was even screened for, like, what if that was required screening before someone got prescribed, right? Like, how big of a difference would just that make? There's just little big stuff like that could change the game.
Absolutely.
The other big, this might lead us to like a different thing, but the other big thing for us is one of the big cons is B vitamin depletion for people who are on birth control, which probably leads to a multitude of other things. But again, personally, like, we get interested in stuff obviously that affects us personally. But so when I've been practicing for about 8 years, when I started interning with Calla, I had just gotten off of the birth control and I was like, I am so tired. And she just kind of on a whim was like, why don't you try a B complex? And I was like, yeah, great idea. Just I'm on it. I'll kind of try anything at this point. I'm a new graduate. I'm like, let's figure it out. I describe it to people like after 2 weeks, I felt like I had coffee in my veins. Like, wow. I was so awake. And I mean, I was also coming off of like 4 years of grad school where I studied constantly and didn't sleep. But it was honestly that quick. And I don't know if someone thinks like 2 weeks is a long time for a medication to kick in or a supplement, but like it felt very fast to me and there was nothing else that had changed. And that is a huge thing when we talk about like, how do you support someone, even if they do want to go on it, right? Because if we have true informed consent, they know the drill. They're like, I still think it's worth it. they want to go on it. Well, then there's another aspect of like, how do we support them while they're on it so that their body doesn't unravel while they're using that product. And I think a B complex is a big way to do that, in a high quality one that's methylated so that they can actually absorb it all. And again, talk about like little big things that would make a huge difference. That's another one in my book where it's like that should be like, you know, baseline stuff for a prescription.
I totally agree. And I think that probably has something to do with the stats CJ said, as far as 9 months later, you know, the risks of depression and anxiety, you know, going up on birth control. That probably is due in part to the B vitamin depletion. So absolutely, let's stay on that. I like that. Let's stay on that topic. So what are some other non-traditional ways to support women who are on birth control?
CJ, do you want to go? I think another one I would think of is just like being able to flush out excess hormones, like making sure that you're detoxing. So having things in place like the sauna or the castor oil packs that you do, Steph, something like that, so that you know you are getting rid of the stuff you are not using. But that's kind of the first one that comes to my mind. CJ, do you have something else?
Which starts with pooping. I mean, quite frankly, you have to be, to eliminate, you have to not be constipated. And a lot of these young girls, they don't have the best diets. They're not getting good fiber. They're not, you know, hydrated. They're not pooping. They're not eliminating some of these more toxic end metabolites from these synthetic hormones. So yes, elimination, detoxification is great. It starts with pooping, which the castor oil packs can certainly help. Sorry to interrupt, but yeah, CJ, go ahead.
Yeah. Well, I think for me, in an ideal world, before a girl goes on birth control, it's like, okay, it's almost like choose your own adventure. Are you going, like, are you asymptomatic and you're only going on it because you're trying to prevent pregnancy? Or B, are you really symptomatic? And this is, after you weighed the pros and cons of everything, this is still what makes the most sense for you, right? Because a lot of the times, you know, there is a large part of the population that they want to do it because they want to prevent pregnancy. So that's almost like, okay, well, you're asymptomatic. Let's do these tests before you go on, like a NutrEval, a complete blood count, the full thyroid with antibodies, because too, the ugly reality is that birth control can start that autoimmune cascade. It can start messing up the gut, changing the gut biome. And so it'd be really nice to get a good, healthy baseline or a preliminary test, and then even, you know, 6 months or 12 months on birth control, and then get a retest and see how is their body on it. That Genova, that NutrEval, just so we can kind of see. So kind of like how Hannah was explaining. So in order for, especially for the birth control, the oral birth controls to work, they call it a drug-induced micronutrient depletion. So the body, to absorb the birth control and for it to be effective, if you will, it's going to metabolize our B vitamins. And so you can have like a car, and that car might get, you know, 50 miles per gallon. You put it on birth control. Now that car or your body's only getting 20 miles per gallon. So it's going to need more metabolic support. So Hannah specifically, she had been so depleted on her B vitamin stores and her B vitamin metabolism. So that's why she had so much more of that therapeutic benefit to replete, where some people, when Steph, I don't know, you probably see it too, you put them on something, they're like, I don't feel any different. It's like, good, that's okay. But we're just trying to make you so that you never get deficient where you get symptoms.
Right. Yep.
But, you know, if the patient's symptomatic, then there's still a little bit of preliminary that's like, well, let's make sure that your symptoms aren't because you're already up, like you've got a messed up thyroid or you've got food sensitivity, that you can't help get them more healthy from a holistic perspective in general. But let's say that somebody's listening to this, they're like, okay, well, I'm on birth control. What do I need to do right now? I think back to the foundation. Everybody needs a multivitamin. Everybody needs omega-3, probiotic, and vitamin D. If there's no such, if access to testing is not realistic, that big foundation. And then there's always extra credit, right? That they can do on top of it, that you can get symptomatic wise, you know, if there's a acid reflux or if there's, you know, excess bloating, you can do digestive enzymes, magnesium, calcium, a whole lot of things. So I didn't mean to make that hyper complex, but to support women, I always like that individualized approach. But again, it's a blanket statement, the big foundation for.
Yep, I totally agree. And I'll also echo what you said, as far as once you're on birth control, because it's depleting nutrients, that can negatively impact thyroid function, because you need the nutrients to make the thyroid hormone also. So you can end up with secondary, you know, hypothyroidism from things like birth control pills. But I totally agree that kind of foundation, you need a multivitamin, definitely B complex, as you were both saying. birth control can impact your microbiome. So that's where kind of a probiotic would come in, which can help with regularity. Vitamin D is important. And then fish oil also can help thin the blood to mitigate the risk of stroke. But
Right.
fish oil can help
And
with a
all the
multitude
mental
of.
health, a lot of the depression, a lot
Mhm.
of the anxiety is high omega-3 and the vitamin D
Yep.
and the B vitamins. I mean, lack
Yep.
of B vitamins really has been known to see, like, here's the anxieties and here's the OCDs and ADDs and ADHDs because you don't have properly supported B vitamins.
And just to explain to the listeners, you require your B vitamins, specifically B6, to make things like your neurotransmitters, serotonin and dopamine and norepinephrine and epinephrine, right? Things to help your mood. So if you're on a medication like birth control, which depletes nutrients that help you make neurotransmitters, your mood can suffer as a result of that. I want to just say a couple more things as far as what else, in my opinion, we could do for patients who are on birth control. So we certainly could also recommend liver support. So they could be doing something like a liver detox. They may, especially if they have history of cysts and fibroids, family history of breast cancer, sometimes taking DIM will help them clear out excess estrogens, eating more cruciferous vegetables and whatnot. But I think those are the main core nutrients, right, that we could help these patients with who are taking birth control. Let's go back to kind of the direction I think you were going, CJ, as far as, well, hold up, let's like reverse and first even decide if birth control is needed and like what other options exist. So let's go there. So if patients really don't need birth control, they're just looking for a solution to their symptoms, what are some non-hormone, I would say, this is almost two questions in itself. I was going to say birth control options for patients who want birth control, but then what are some non-hormone options also for alleviating the symptoms that they're electing to potentially, right, explore birth control for? So there's kind of two questions here. So let me break that down.
Okay, thank you.
So first, let's just talk about, I guess maybe this will be a quick one. What are non-hormone birth control options? So for women who, let's say they are in grad school, they really don't want to have a pregnancy till they're, done with that. What are some non-birth control options in your opinion?
So I always, go ahead, Hannah.
Oh, no, yours is going to be sillier than mine. Go for it. I just know what's coming out of your mouth.
yeah. She did. So I was going to joke and say abstinence is always, step one. That's a great birth control. But so male condoms, but for the females, because I feel like this is so much more female oriented, there is a device called the FemCap. Steph, I don't know. Have you fitted women for these?
I haven't. You asked me that before, but yeah, no, I haven't.
Well, and now because of the wonderful world of telehealth, you can get this. So there's a website, and I don't know, Stephanie, if you want to publish it, but it is a device that sits over top of your cervix and you can place it. So kind of coming back to that conversation that Hannah does so well in our Girl Talk, she really explains the anatomy so well. But so many women like haven't even felt their cervix, and they're like, I've been putting a tampon in forever, but I didn't know I could feel my own cervix. And so the idea of putting a fem cap over top of their cervix is like this really foreign thing, but it's really not that hard. On that website, they have a beautiful video that shows how it's placed, but it's good for up to 48 hours. So that's nice because you can take it out, you can sanitize it and put it in. But if we were teaching women how to understand their cycle and to know where they're at in their cycle, we can show them how that they know their body is ovulating. So one of the things that Hannah does is she's got the Lady Comp, which is a hyper-specific body temperature analyzer. And so our body temperature will spike, which I don't know if Hannah, if you want to get into that on the days of ovulation, you're more familiar with that than I am. But you can kind of see. So I like explaining to women that there's the fertile window and then there's the ovulation window. And sometimes websites and podcasters or health coaches will use those interchangeably, but they're kind of different. So the fertile window is kind of this 4, 5, 6 day range that's kind of around ovulation. So when the follicle gets released, when the egg gets released, the egg will only survive for 24 hours. The fertile window, though, is because sperm can live inside of us for up to 5 days. So I can have sex with my husband on day 12, ovulate on day 14. And because of what I had sex on day 12, that led to conception. And so we can teach women if they know that they can do the basal body temperature or luteinizing hormone. So that's kind of the low expense, I guess, if you will, testing that you can pee on these testing strips, and they'll tell you when you get the spike of the luteinizing hormone. Clinically, I like getting the quantitative measurement versus just a positive ovulation test kit or a negative test kit. So some of the testing kits on the market for ovulation just say positive or peak, but they don't say how high that peak is. So I have some patients that they might be peaking, but it's really not a good, robust level of luteinizing hormone. So there's various degrees of quantitative devices out there, but my new favorite now is called the Myra or the Mira, because those testing kits can not only tell luteinizing hormone, but estrogen and progesterone, but then you can also get that follicle stimulating hormone. And so now we can track them over a 28-day cycle. So some women, it's just good that they can track on their own so they know when that ovulation window is and when that fertile zone would be, which I think is helpful. But like when my daughter, when she gets her period, I want to be able to teach her this cycle so that she knows from an athletic standpoint, so she doesn't get injured, but also from a body injury and recovery standpoint too.
So I think what CJ is kind of wrapping up there is there are, as far as other alternatives to birth control, is there are barrier methods, multiple of them.
Thank you.
There is this, some people call it natural family planning, but it's basically tracking your cycle and knowing the ovulation cues. So one of them is temperature. One of them is testing luteinizing hormone. One of them might be checking your cervical mucus. Again, things that you kind of need to make girls okay with, because they're gonna, if they get to learn from the internet, most of the time they're gonna be told that that's weird or gross or whatever. And I always say, like, those same girls were truly just like picking their nose like 3 years before this, so it doesn't matter. Like they were just gross, you know. And really with the temperature thing, I also think if you can count on a girl to wake up and take a pill every morning, she can also take her temperature in the morning. I don't think that is too much to ask. I think it's the same thing. It will travel with her to a sleepover like a pill pack would or whatever. So though there's more to the cycle tracking and that kind of stuff, but I agree with CJ, and that's the thing that I totally want my girls to understand is like there's a pattern to this. It does take a couple of years to regulate. So if it's not perfect right now, that's fine. That's kind of the thing, is it takes time. So that's a whole nother pregnancy prevention in itself. And then we get a ton of questions about copper IUDs because people do want to know, you know, is there a non-hormone option? So how a copper IUD works, however, is that its goal is to create enough inflammation in the uterine lining so that a pregnancy can't happen and doesn't want to be there. So Steph, you might agree, but like a lot of the issues you are helping people with is just taming the inflammation in their body so that they can get out of an autoimmune disease or get out of pain or, you know, some chronic issue that they've had for a super long time. Is just like, how can we put the fire out and get as much inflammation gone as possible? Well, that copper IUD, because there are no hormones, its goal is just to stir up as much inflammation as it can without getting kicked out of the body so that no one wants to live there. So just making that uterus inhabitable. And like I said, we get that question at every talk. We get it constantly of just, you know, is there like a least bad? And my answer is kind of like, you kind of have to pick your poison if you do want to go on a birth control. So maybe that means you try some stuff and it doesn't work out and you try something else. CJ has talked about like the low dose progestin maybe being the least disruptive. I think that's, I don't know enough to argue one way or the other, but yeah, that's kind of where we're at. I think everybody has a different genetic makeup, obviously, so that there isn't going to be one least bad fit for everybody.
Totally agreed. Gosh, I want to unpack like 10 things there, but I would agree for most people. I think the low dose like progestin only pill is okay. You do need to think about that individual's genetic like clotting risk. I mean, there's a lot that can go into that decision, including the anticipated length of, you know, the use of that. So for some people, if they're going to have one IUD, that's it. They're going to have an IUD maybe 3, maybe 5 years, and they really don't, and that's the only time they've ever been on birth control. They're otherwise healthy. They don't foresee long-term use. Am I okay with an IUD once? Yeah, I think that's okay for some people. I would agree with copper causing problems. I used to recommend that. I mean, like years ago, I used to recommend that as a non-hormone option. And then I started seeing elevated copper levels in patients, and I saw a lot more elevated estrogen levels, heavier bleeding. So for many people, the copper IUD actually worsens symptoms because before they had light cycles, now they have heavy cycles, they're estrogen dominant, they have high copper. I do see for those, if listeners are in that situation, there is still hope for many of my patients who the copper IUD is removed from, were able to get the copper levels down and, reduce heaviness of cycles and whatnot. But I've seen a lot of challenges with the copper IUD, so I'm not a huge fan of that. But again, you have to take one's individual kind of risk factors into consideration with the best decision for them. In regards to kind of what you were saying, what we both were saying with natural family planning, I think we should just be taught this in school. Like this should be, more thoroughly discussed so women do understand when they are.
And how baffling that like you got through all the schooling you have done. CJ's gotten through all of her schooling. I got through all of my schooling. Not one of us was taught in that whole time, like, here's how you track your personal cycle. You got taught like in the extended schooling that we had, here are the phases of the cycle, right? And here, but it was never like, here's how this directly applies to you. Let's get some personal knowledge. Here's how it applies to getting pregnant. Like that applicable part never happened in all of our combined years of schooling. Like that is just, and that should be like middle school.
I'll tell you one, and I remember, as I was trying to achieve a pregnancy, one thing that, because I did some Creighton method charting and whatnot, I was never taught about cervical mucus. Like, hello, you can't, back to what you were saying, CJ, just about, the egg actually surviving in the cervical mucus, right? You have to have cervical mucus for the egg to survive that long. And many women don't have any cervical mucus, which actually is a huge plug for N-acetylcysteine. I heavily use that in my patients who are trying to conceive because it's great for sinus infections, right? For respiratory issues, to thin the viscosity of the secretion here. But guess what? It also will thin cervical mucus. And you want that egg white, really stretchy consistency. That's the best over an inch, right? From a fertility standpoint. So yeah, cervical mucus was never brought up in any of my training that I remember. And that's a huge gauge for women. Back to tracking temperatures also, there's an answer to maybe the parent who says, well, my daughter won't check her basal body temperature, although she is thoroughly capable. There are devices, biohacking devices like the Oura Ring. I've been wearing this for probably 5 years. I don't even know. I don't have to, check my basal body temperature. This just checks it every single day, right? These are affordable devices that last I've had this years and still, knock on wood, right? Working just fine. So then I can combine things like the basal body temperature from here, the cervical mucus. I've used the Mira tracker for years as well. So I can see that LH surge. I can see my estrogen go up, it go down. I can see if I ovulated based on the progesterone, subsequent progesterone rise. So I would say it's becoming a lot easier for women to kind of take back that power and that control of knowing their cycles and their fertile window. And I think I will say this, it's easier for women who have regular cycles. It can be much more difficult for patients with PCOS, patients whose cycles are, every 3 months, whatnot. That's kind of a more complicated conversation. But for women who have regular cycles, it's becoming a lot easier for us to use natural family planning, either to conceive or to not conceive, right, as a non-hormone method of birth control. So I think that was great discussion. I'm trying to think if there was something else I wanted to mention on that.
Stephanie, do you think between like all of your work, just with patients though, and in practice, that like your Oura Ring and these wearable devices, do you feel like it's helped empower almost like our intuitive sense that now you don't even need your ring to tell you that you're like, oh, I know I'm ovulating, because it's helped you kind of cue in to a little bit more of like, oh, I'm really stressed out. I don't know if I ovulated this month. Or like, have you been able to see that in various patients?
Yeah, I just love data. I'm kind of addicted to it. I know some people get frustrated, like if their sleep score is bad, they're like, I don't even want to see it, because then they get discouraged. So like, I think there are pros and cons for, these sort of devices. But for me, yes, I can pretty much wake up now and know like, okay, that was not a good night's sleep, probably have a poor sleep score. My heart rate variability probably sucks. And like, yes, yeah. I think I'm now to the point where I can many times, I don't know, kind of predict the number I'm going to see in the morning. But I'm addicted. First thing in the morning, I wake up, I connect my device to my phone, I see my what is it? My resilience score, whatever. I forgot what it's called.
Your readiness.
Readiness score to kind of see, okay, can I go for a run this morning or should I take it easy? Like I listen to those cues. I think they're important. So I do think it has empowered me. I do like that information, but I can see how for certain personalities, it may create more anxiety. So I think kind of depends on the person.
Well, and even knowing that too, like the thing that's best for me about the Aura Ring is like I don't need to be told to work out. That's not an issue for me. I need to be told to sit down. And I think CJ mentioned at the very beginning, men operate on a 24-hour cycle. They can wake up, do the same exercise, have the exact same plan to their day, go to bed at the same time, like every single day. They can do that. But as a female, you cannot. And that week that you are menstruating, you need to go in your cave and take more naps, and you aren't going to hit a PR, and you probably shouldn't work out every day. You should take more rest days, and
you should definitely not fast also during those
you
times.
should definitely not fast.
Yeah.
You need to consume nutrients and refill your body. But so not only like using a device like that, or how many teenagers have an Apple Watch, but knowing that they didn't do anything wrong if they have 3 days in a row where their score is rough, that's probably perfectly designed to tell them like, hey, but these are the 3 days where you lay low, like that's the advantage. And then if they know that, then like, hey, in a week your score is going to jump up super high, and for then that week you're going to be beast at whatever you want to do, and that's totally fine. So just it's also how do you read it, and read it well, knowing your design versus a male design.
Yeah, good.
Well, what I like about the wearables, like what I've witnessed in practice, is that I have a lot of high resilient women, and I love it. I'm motivated by what these women have done and accomplished in life. But a lot of times I'll ask them like, hey, are you stressed out? And they're like, no, not at all. Why? And I'm like, well, based on what you told me, I don't mean to project, but I think that's kind of stressful, but they've been so disconnected and they've powered through. And I'll convince them to either get like a Garmin watch or an Aura ring. And after they get a couple, weeks worth of data, like, hey, turns out I'm stressed. Here's my high stress readings. And they didn't know, because that's just been such a day to day. They're like, this is always how I've operated. But now that they have that feedback, it's kind of given them that gentle permission of, your heart rate variability is a very, very specific measurement. And it's, between the sympathetic and parasympathetic. And it's showing that your body can't get into that rest and digest state. If we can't get into that rest and digest state, hello, we cannot make our hormones. They're made at night, manufactured at night. And so, gee, I wonder what's like messing up this whole cascade from sleep quality to you've overpowered your own awareness of you've got a lot going on.
So true. And I believe, I didn't want to say this word on the podcast, but I'm going to say it. So I believe, CJ, you told me you saw before you had COVID, your heart rate variability tanked like the day before.
Yeah.
Like you saw that. And I recently had this halo face laser done, and I was told by a colleague, oh, your heart rate variability will tank the whole week after, because you basically are frying your face. Right. I mean, and I said, and I was like, okay. And it did. I mean, it didn't tank like to the degree, like if I was sick, it didn't tank, but it did go down. And I thought, oh my gosh, but I'm like recovering from this wound, which I self-inflicted. And now my skin looks better, and I'm glad I did it. I don't think it was dangerous to do, but it's just interesting to take that into consideration. Like, yeah, I shouldn't go, run 5 miles. I just had this procedure done. And my biotracking device is telling me it's time to take it easy. So I think that's the strength of this wearable tech, is that it just gives us more information, then we get to choose what to do with it. A few more questions here. I want to go back to kind of, I think maybe what I was saying that we took a couple tangents off of, like, let's go back to what are some other solutions for patients who are coming in, maybe just wanting help with their painful periods or their acne, right? What are some non-birth control answers to patients who are experiencing kind of hormone imbalances, if that makes sense, right? So they're seeking, maybe they would seek out birth control from their conventional doc, but what could they seek out from providers like yourselves? And then I'll comment on this too.
Yeah, I think that, and CJ has more functional medicine training than I do, so her answer I think is going to be more in depth. But I honestly have really good luck with supplement called FemQuil from Zymogen. Has done super well. It's not that it's for everybody, but man, it's like a very low invasive and low cost place to start, if especially for difficult periods or endometriosis, PCOS,
Sure.
things like that. And that has been super helpful. Getting the inflammation dialed down with food sensitivities or food testing, that's a big deal. And just like you had mentioned before, getting your gut working properly, because if your hormones are off because you aren't getting rid of excess hormones, you aren't eliminating appropriately. So those are places I would start, but also checking to make sure they aren't malnourished with other labs, or if they've never been on a multivitamin. I always kind of offer, along those lines of informed consent. I'm like, we can spend the money and run the labs. I'm game for it. We can also do a guess and check. It's just obviously there are pros and cons to each of those. So if people are really tight with the budget, I always say, like, I don't mind doing the kind of guess and check off of a very educated guess, right? Off of what I've seen and what I know. But you can go that route too, and just try and fill their nutrients up, especially with like a teenager that isn't eating well, doesn't eat breakfast and then eats like takeout or fast food for lunch or something like that, and then is too busy in the evenings to eat a real dinner. Like, yeah, they're probably missing some stuff there.
Absolutely.
So those are the big three for me, I think.
Yeah, for me, I feel like just number one, if they have a messed up period, go to the gut first, right? Gut and sleep. And so sometimes too, it's just the reality check of the sleep hygiene of their, a friend of mine texted me this article when COVID kind of happened and everybody was on lockdown. There was this, like, they called it a sleep revolt, that parents, because their kids were home all day, they would finally get them to bed, and then they would like stay up because they had a long quiet time. And it was like this sleep revolt that parents weren't going to bed until like midnight or 1 a.m. because that's when they had quiet space in the house. But I think just like the sleep hygiene in general, I mean, we're addicted to the blue screen, we're addicted to the TV show, and we've fallen away from discipline of really honoring, like, we need to get to sleep and make it a priority. And so between checking in with them on the sleep hygiene and seeing if they need to set some healthy boundaries up, and then the food sensitivity. So then there's always kind of like what Hannah said, like the guess and check. If food sensitivity isn't realistic or in the budget, then it's like, all right, you need to go 30 days gluten-free, dairy-free. And then if sugar is a problem, we might throw that trifecta in there as well. If they self-admit, yeah, I have a sugar problem. And sometimes people don't realize they have a sugar problem. Sometimes I'll ask people, I'm like, hey, I want you to do a food journal for 7 days. And they find out that, before 8 a.m., they've had 75 grams of sugar between what they thought was healthy breakfast and, a healthy shake, turns out was jam-packed with a ton of sugar. So I think that, and then honestly, the iron deficiency in women, especially bleeding women, is so common. So usually like an iron pill and a methyl B. And it's not that I like that before the foundation multivitamin. I like that because it's probably going to give them symptom relief first, where they might not see as much symptom relief on the multivitamin.
Yeah, I would agree. I want to comment on both of those things, but I want to just go back also to, like, when a patient presents saying, oh, I have hormone related acne and the doctor is recommending birth control, like, for at least from my standpoint, I always explore if it actually is hormone related acne, right? We can check hormone levels to see if that's the case. However, many times it is just due to inflammation and poor gut health, like you're saying. So examining which foods, like you're saying, run food sensitivity testing or take them off gluten and dairy to figure out if that's what's triggering the acne. Well, great, that will improve their overall health, just changing their diet in general and prevent the birth control. Or if, let's say, they really are having heavy bleeding, so they obviously need the iron. Why do they have heavy bleeding, right? Do they have high estrogen? If that's the case, putting them on a birth control pill with estrogen in it is not really going to help. I mean, it may actually help, but it's going to further worsen that estrogen dominance in that individual. So exploring why they have the estrogen dominance. Are they a poor detoxifier? Are they not pooping? What kind of personal care products are they using? It makes me want to cry what I used to put on my body. I used to go to Bath and Body Works and, slather on all the toxic stuff. I had so many chemical hair straighteners. I mean, I guarantee all of that toxic burden that I, again, self-inflicted, but I also don't have the best detoxification genes, led to the endometriosis that I had. But no one was connecting those dots for me. Like now I can reflect back and see the progression, but in that moment, no one was connecting those dots. So for mothers who are listening, right, when your daughters are complaining of some of these symptoms, rather than just jump for the birth control, let's try to connect these dots. Let's try to figure out why they're having the acne or the heavy periods, whatnot. I think fragrance and our heavy use of plastics doesn't help. I think living in Iowa with herbicides and pesticides floating around in the air, right, that doesn't help. Just eating organic can be beneficial. They're just a lot of things, even including reducing stress, as you were alluding to, CJ. I mean, I've never seen so many wired, anxious teenagers in my life, right?
I know.
I mean, even they are needing to do yoga and set
Mhm.
healthy boundaries and these sort of things that I used to preach to my perimenopausal women. I still am, but I'm also now preaching to the younger patient population. But I want to go back to, I mean, really just the principles in my book, Your Longevity Blueprint, right? So whether someone comes in with acne and painful periods, or maybe they come in with headaches or fatigue or diarrhea, whatnot, I'm walking them through kind of this longevity blueprint, all these functional medicine principles where we are testing for the root cause of the problem. And that's really what sets functional medicine apart, is this advanced testing. So we can figure out, right, the dysfunction in the body and fix that. If we determine a hormone imbalance is present, I think what you were saying, Hannah, is you were recommending some herbal support. I don't know that product off the top of my head, but I do use, especially in young patients, and this is what I took when I was younger as well. I took herbs to help boost progesterone and help lower estrogen, which is really what I needed. I just needed probably more of them. There are herbs to lower androgens. If someone really does have a high DHT, right, high testosterone that's contributing to acne or hair growth, right, if they have PCOS, there are herbal formulations that can help there as well. So I think, the summary, a couple more questions here, but the summary of what we're offering today is really there's hope. We need to provide better education, but there's hope for these patients. But birth control is not the only option. So I don't know if you guys want to say anything else on birth control before we go to non-toxic feminine care products, but are we done with birth control, or are there more things we want to make sure we say on that topic?
Well, to echo you in your book with your longevity blueprint, Stephanie, is, my goal is that my daughter doesn't have terrible symptomatic periods, right? And so if we can incorporate so much about what you lay out in the foundational principles in your book, our daughters are more likely to be set up for success, that where they're not going to be like, well, what do we do? And this all sounds like a lot of the testing and overwhelming, that there could be so many different issues. It's sometimes, again, back to the foundation of what functional medicine is diet, lifestyle, and that cascade. So our goal is that our kids don't have, and their friends and our nieces and nephews don't have the symptom cascade that, you and I and Hannah grew up in the Bath and Body Works generation, things that we just didn't know at the time. Now that we know better, hopefully we can help for the younger generation.
Absolutely. Know better, do better. So I think part of my problem also with my heavy cycles, I was using these chlorine soaked tampons, which were just really contributing to the problem, which I clearly no longer use. But what are some of your favorite non-toxic feminine care products also? Because as we're talking about, periods and cycles, let's kind of delve into that.
Yeah, I would say anything that is, says no chlorine on it. I personally will order from Tampon Tribe, which is just like it's nothing but organic cotton, and I'm kind of hippie as far as like sustainability stuff. So like the packaging is all compostable, that whole deal. And they come wrapped in like little not tweed, burlap. They come in like burlap bags.
Wow.
Which I'm like, I'll just rip them up and put them in my garden because that's how I roll. But I do not. I think a cup is a great option, a cup or a disc if you can find those. They do have disposable discs as well as like reusable discs that kind of function as a cup too. So it's basically like a silicone cup that you can wash out and reuse. I personally haven't found my best fit for that yet. But there's also like period underwear. So the Thinx company, the THINX, I think there are also several of those now too. They don't have like the corner on the market on those anymore, but, and I think it doesn't have to be one or nothing, you know what I mean? Or all or nothing. It can be, you can use this blend of a couple different things, especially if your flow is like really heavy for one day and then kind of fine the rest of the time, or something like that. So and I think the cup can be a little tricky too for like girls in high school who are in a bathroom and are like, how do I wash this out in the bathroom and that kind of stuff. So that's kind of the direction I would go, is just, can you find something that is not bleach, absolutely no fragrance at all. And that even just the skin down there. So say it was like a pad and not a tampon, even the skin of the perineum's like one of the most vascular areas of all time. So you're just wishing that stuff right into your bloodstream, unfortunately. But yeah, CJ, I know you've had more luck with the cup situation.
Yeah, I love the cup. But like traveling, I'll do the organic tampons just because it's easier. But I love it from the sustainability standpoint of that, creating more trash and more waste, that it's reusable. It's really easy to clean and wash. But again, if you're out and have to go to use the restroom in public places, like high school bathroom, it's not maybe as ideal. On lighter days too, it's a lot easier that you can change it in this stall and just bring like a makeup, like a non-toxic makeup wipe too, that you can use in the stall. So there are options, but the even the panty liners, too, we have to really watch those labels.
Yep. I had used Lola for quite a while, and to my understanding there, the paper, I guess it looks biodegradable, whatnot. It's certainly organic, non-chlorine soaked. So yes, great tips here. We haven't really gone there yet, and I know I'll wrap up the show because we've been talking for quite a while here, but I would say for women coming off birth control pills, everything we are saying still applies to you. We still need to fix your gut and replete nutritional deficiencies and reduce stress and detox the body, right? All of these principles apply to one coming off birth control as well. Are there any quick tips either of you want to mention to a woman coming off birth control?
The liver detox. Liver detox, yeah. And two, depending on the family history or the genetics, if there's high risk of cancers, any type of cancers, they should probably do that liver detox for like 21 to 28 days. And then, they can do a lot of that metabolic testing to see like, okay, what is your estrogen load, to see if they don't need to do it again in 3 months. I mean, you don't want to keep detoxing without taking a break by any means, but what they can do to support their body. And then two, I'm like, if they're coming off it, I'm like, all right, then let's have you come off, do the liver detox, eat clean, solid for a good 30 days. And then we can get a baseline of where you at, complete thyroid with the antibodies, a lot of the inflammatory markers, and then the estrogen and progesterone, along with the testosterone, which is big in your wheelhouse stuff.
Yep. I'm glad you mentioned the estrogen metabolism testing, because I was going to kind of wrap up the show mentioning that. But to tie into that point, my last question for you ladies is really what your preferred means for detecting female hormone imbalances is. So just as far as like hormone testing, is that something that you ladies are doing much of? I'll say my piece here on that at the end, but.
Yeah, Stephanie, because we're so lucky that we practice in your town. We do very minimum, because once we see, so like a day 21 estrogen progesterone ratio, if we're going to run it at a local lab, we have done the Dutch testing, which will do some of the estrogen metabolites. But typically, if we see that they're so out of whack, then they get on your books and we hand it off to you.
I'm happy to help. Happy to help you. I'll just put a plug in here for patients, echoing back to how you mentioned at the beginning of the conversation, CJ, you wish before patients went on birth control, we could test their hormone levels, right? I think that is super important, right? Testing early in life. It's easy to test hormone levels in the blood. Sometimes we need to test in saliva. Sometimes we need to test in urine. And I have other episodes talking about that. One episode where we talk about the Dutch test. The entire episode is on the Dutch test. So I encourage listeners, listen to that. I will post a link in the show notes. But essentially what you were alluding to, CJ, was looking at how the liver is clearing out excess estrogen. So the only way to look at metabolism or elimination is through urine, not through blood. So we can see hormone levels, but not how the body's detoxifying those through the blood. We can only see those in the urine. And so if a patient has been on birth control a long time, and potentially if they don't have the best genes and the best lifestyle, right, we may see some unfavorable hormone metabolites on that test. So that can be altered using nutritional principles like the B vitamins you mentioned, using DIM, which is an extract from cruciferous vegetables, using things like glutathione and other antioxidants. So I love the urine hormone metabolism testing because I do think it gets to the root cause of fibroids and cysts and cancers and endometriosis and whatnot. So that is something that if you're listening and you would like that test to be run and you're a patient at the clinic, certainly call and we can get that test run on you. But there are a couple different companies that run it. The Dutch test we were alluding to is through Precision Analytical. They don't bill insurance. It's cash-based lab, but it's an awesome, awesome test for hormones and cortisol and hormone metabolism. So yay. Well, as we wrap up the show here, ladies, I want to ask where listeners can find both of you. So who wants to take that question?
I can. Yeah, we practice in the same building and we sometimes share patients. Like if you start with one of us and we don't think it's the right fit, we can send you right across the waiting room. It's all good. But we practice at a clinic called Back in Line in Hiawatha, Iowa, and our website is mybackinline.com and our Instagram is also mybackinline.
Awesome, awesome. I want to conclude the show, as I always do, asking each of you your top longevity tip. But before I do that, I do want to give you one last opportunity. If there's anything else you want to say just on any of this. Do you feel like you've said your piece, or is there anything else you want to add?
The only thing that is missing for me is a question that we often get is we will have moms desperately bring in their teenage daughters to fix their hormones, but they're not willing to go off of hormonal birth control. And so I think keep that in mind if you're listening to us kind of like a desperate parent. There's no way to fix their hormones while they're on a high dose hormone. So, or a low dose hormone, right? Like their hormones are being changed by that. And there's definitely things we can do to improve their lifestyle around that. But know that going in and asking for like hormone balancing isn't really a thing on that, but we can do other things to hopefully take some of the burdens off of them chemically and emotionally and all that kind of stuff. So it's not that there's nothing to do. It's just, I don't think it's the thing that they're wanting or that they think they want, I guess. That's how I would put it. But
yeah, birth control will skew your hormone testing. Yeah, absolutely. Yeah, guaranteed.
Yes.
Yeah.
Yeah, Stephanie, thank you so much for not only having us on the show, but just having the dialogue for what you see in practice. And it's just, I love having this conversation. I want to keep having it over and over again. And thank you for what you do. Thank you for being the one that introduced me to functional medicine. It's changed my life personally and professionally. I can't imagine where I would be without it. So I appreciate you and our life and our community.
Oh, thank you. Thank you. Well, we certainly appreciate you guys as well, having you around, especially to see kiddos also. So tell me each of your top longevity tips. Could be something you've already said today, but what comes to mind when you think your top longevity tip?
Do you want me to go first, CJ?
Yeah, I was pausing. Sorry.
No, it's okay. I think that mine is learning how to change the mindset of like things going wrong in your health to just gain perspective that your body is trying to learn something new, or that you need to learn something new, or that there's a lesson in it. So for instance, like when people get sick or say like, I only get sick when it's my day off. It's like, yeah, because your body finally has time to chill out and it let its guard down for a day and it needs kind of like an update. Like I love how I'm a huge Zach Bush fan, and he describes like catching a virus as it's like your body is upgrading its software. Like you literally have to integrate parts of that viral DNA into your body. That's how your body evolves and learns how to do new things. In reframing things like sick days of like, oh my gosh, I'm so broken, I can't believe I got sick again. Or it's like, man, I really needed some downtime so that my body could upgrade so I could be better in the future. And I mentioned it before, but using that mindset to let your kids and your family know that they're not faulty when something is uncomfortable. So because they have pain during their period doesn't mean it's broken. It's okay. Like it might be a sign that we need to figure something else out. We need to find a way to support you, or you need to take time in your schedule to take a nap or something like that. But approaching it as a learning aspect instead of being one, terrified every time something hurts, or two, wanting to shut it down immediately. I think changing those in your brain to more of an opportunity can just be huge of how you treat your health in the long term. And yeah, longevity, like being able to live longer because you're not scared and you're not broken.
She talks so much more eloquent than I do. It's really lovely.
Give yourself more credit, but yeah, I agree. She's done a good job.
No, honestly, when I reflect on that, I love this time of year as we kick off the new year. So of intentions and mindset. So then I have to self-reflect on what am I doing wrong that does need to be shifted? That what am I doing wrong that's affecting my health negatively? And it's so silly how simple sleep, breath work, and water is. And so it's kind of like the rule of 8 hours of sleep, 80 ounces of water, 8 minutes of prayer, breath work for that longevity. That, there's so much that we can quick run to the wearable technologies or the really nice expensive supplements and do all this stuff. And it's like, man, if we just get back to the basics, it's really funny how if we just honored those three things, that it really would help lower the burden on our overall body and recovery and hormone health and especially brain health.
Absolutely. I totally agree. Back to the basics. Thank you both so much for all of your time today, coming on the show and just advocating for dialogue on how to improve women's health, really starting at a very young age. I love that. Really through better informed consent, non-toxic female, or I should say feminine care products, and even advocating for hormone testing. So thank you both so much for the work you do for our community. This was awesome. This was great girl talk. Thanks so much.
Thank you.
Thank you.